Hi, my name is Delisha Finn, a current practicing respiratory therapist, and I have for you interesting and visually stimulating PowerPoint lecture. The title of my lecture is RIP to Asthma, Smoking, and COPD, and what it entails is the subtitle Succession and Maintenance Plans for a Better Life. What I want you to take away from this lecture are these objectives: being able to medically define asthma and COPD, recognizing the signs of symptoms of both. And I want you to be able to discuss smoking cessation. And I also want you to understand how to treat and or manage these topics using an action plan. And also understand the implications from peer-reviewed research that I'm going to show you. To begin, COPD is defined as chronic inflammatory lung disease. And the actual COPD stands for chronic obstructive pulmonary disease, and it consists of emphysema, chronic bronchitis, and asthma. I have a picture here for you, and I really enjoy this picture because it shows you the interaction of the three different lung diseases, and it shows you that a patient may have one or two or all three of these lung processes. Oftentimes, COPD patients are easily spotted, especially with me being a current practicing respiratory therapist. It can be easy to recognize when I have a COPD patient. A lot of times they are either a chronic bronchitis patient, which would be tend to be more overweight and tend to be look more cyanotic and blue, or they can be an emphysema patient, which will look more frail and fragile, and they'll have the flushed look color. Chronic bronchitis is diagnosed as a daily productive cough for 3 months or more in at least 2 consecutive years, while emphysema, on the other hand, is a pathological change of permanent enlargement and destruction of distal airways in the lungs. In COPD and asthma, although they overlap each other, there are some differences. The main difference being in how the inflammatory response occurs. Of course, with both of them, you have your triggers. Either it's pollen, cigarette smoke, or what have you. But in asthma, there is a certain cell that responds, the eosinophils, and in COPD, you have your neutrophils respond, which causes the airflow limitation. To treat asthma and COPD, there are numerous respiratory medications available to alleviate that obstruction and constriction that they have going on. We have albuterol, Advair, Spiriva, and numerous other inhalers and corticosteroids to help reverse the lung pathology temporarily. An important aspect of these lung diseases is the importance of managing the disease and not just treating it. Because with our different respiratory medications, we have relievers, we have controllers, and we have preventers, which would be in the same category. A maintenance, we have the maintenance drugs and we have the rescue drugs, in other words. And we have to teach our COPD and asthma patients that we want to maintain the disease. We do not want you always coming into the ER because of COPD and asthma exasperation, which we oftentimes see a lot, simply because the patients are not in compliance with taking their medication scheduled on time and knowing when to recognize when they're having an exasperation. Here I have for you a brochure that discusses the impact of COPD. The impact includes that it is the third leading cause of death in the U.S., with an estimated 12 million individuals who remain undiagnosed. The disease limits normal physical activity. It causes exertion upon household, just while doing household chores. With a lot of people, it affects their ability to work. It affects their ability with sleeping. That leads us into another disease process called sleep apnea. It causes 1.5 million emergency department visits, and therefore it costs America 49.9 billion in expenses. These lung diseases are very important, very common, and cost America a lot of money. What's interesting about asthma and COPD is the fact that the lung process could have been prevented if simply the patient had not smoked cigarettes, or if they simply had been more aware of the harmful side effects of secondhand smoke. Cigarettes contain a deadly mix of more than 7,000 chemicals, hundreds of which are toxic. And just because you're not smoking the cigarette doesn't mean that it's not going to affect you. In my opinion, if you can smell it, then it's going to be affecting you. A lot of times working in the hospital, I've seen um, the wife who was with the husband for 30 years and he smoked a pack a day, and him not have lung cancer. And lo and behold, the symptoms that she's been having for the past few months turns out to be end stage lung disease. And she had never smoked a cigarette in her life. So that's just important to note that, like I said, although you may not be the person smoking the cigarette, it can profoundly affect you as well. Since smoking is the main cause of asthma and COPD, of course, we as respiratory therapists want you to stop smoking cigarettes. I have here a brochure from the CDC discussing what happens within the very beginning processes of you or a patient that stops smoking. The brochure continues to explain that within 20 minutes of quitting, your body already begins making the necessary changes that it will continue on for years. Immediately within those 20 minutes, your heart rate drops. After 12 hours, your carbon monoxide levels in your blood drop to normal. Within 2 weeks to 3 months after quitting, your risk for heart attack begins to drop, and your lung function begins to improve. Within 1 to 9 months after quitting, your coughing and shortness of breath decreases. After 1 year, your added risk of coronary heart disease is half that of a current smoker. After 5 years of quitting, your stroke risk is reduced to that of a non smoker's 5 to 15 years after quitting. And 10 years after quitting, your lung cancer death risk is about half that of a smoker's, and your risk of cancer of the mouth, throat, esophagus, bladder, kidney, and pancreas decreases. After 15 years of non smoking, your risk of coronary heart disease is back to that of a non smoker. But just listen to that. It takes 15 years before you can return to the normal. In regards to the management of COPD and asthma, and recognizing that a patient needs to quit smoking, both of these situations need an action plan. And when a patient meets with his primary care physician, an action plan should be drawn up. But from my research in other classes, I have read that a lot of times these physicians and other healthcare providers fail to provide an action plan for patients, and it leads to them not understanding their disease process, not understanding how to manage it, and not understanding how to treat it. And therefore, we have increased emergency room visits, we have increased resource utilization problems, and just a negative impact on the economy. And therefore, these patients should have an action plan developed. And an action plan is a document that lists steps that should be taken to accomplish a goal. The main goal being able to better deal with their disease process and to have an increased quality of life. Here I have for you some example of action plans that are related to the topics we are discussing in regards to COPD. And we look to the left and we see the COPD action plan. Now, it's a little bit more detailed because it's an actual disease process that we are dealing with and not simply a bad habit. The disease process may be as a result of the bad habit, but the action plan is greatly needed and in even more detail because it's a disease process. This example of an action plan is, I think, really, really effective. It shows you the symptoms of each severity. You at your normal state, you're feeling good, no issues. You can do, your normal daily activities. At the second level of severity, you're feeling a little bit sick. It's harder for you to breathe. And then it has listed the action that you should do if you're feeling that way. And then if you're in the red zone, you're not doing so good. It has listed um, some more characteristics of not feeling well, and it tells you what you should do. So at each severity of the disease process that you're having, it tells you the symptoms, and to effectively get rid of a habit, there is a process that you have to go about doing it. The first step is to start. So the first letter in start is S, as in set. You have to set a quit date. A lot of times it's not, we would not advise for somebody to quit cold turkey, just all of a sudden just quit. You need to prepare yourself for this, because this is a habit that you've most likely had for a while. You're going to need to prepare yourself for it. The next thing to do is to T, tell your friends and family. A, anticipate challenges, and R, remove any possible temptation. Remove the cigarettes from the home. Remove them all, the ones in your car. Remove cigarette lighters. Remove it all. The importance, it's important to tell your family and friends so that they can give you support, so that they can know that, hey, just in case they're a smoker, then maybe they can be more considerate about smoking around you, so that you cannot into that fall into that habit again. You need to also, like I said, anticipate challenges. Know your triggers. Know what's going to cause you to say, "Hey, I need a cigarette. I can't handle this." And in in regards to that, you need to form positive habits instead of picking up a cigarette when you're frustrated. Maybe read a book, go outside, take a walk, figure out something that can take the place of that nicotine. And of course, if you're like me, you might just can talk about your problems. T, talk about it. That may help turn down the urge to smoke a cigarette. And the main person that you need to talk to is your doctor. Your doctor can help get you extra resources. In addition to creating an action plan for our patients that have COPD and are attempting to quit smoking, we also need to take advantage of the wide reach social media has to our patients and in healthcare. And as a result of that, I would like to discuss professionalism in a digital age with you all. According to the Pew Research Center, a notable research center, the vast majority of U.S. adults are internet users, have a smartphone, and use social media sites to access and share information. The most popular social media sites are Facebook and LinkedIn, as demonstrated by this image I have here for you, because Facebook and LinkedIn and Google are all in the middle of this sphere. However, there is a vast dynamic social media landscape that also includes dozens of sites for publishing, sharing, discussing, and networking. The explosion of social media and the ability to access the internet almost anywhere and anytime using wireless internet and mobile devices presents exciting opportunities and new considerations for healthcare organizations and professionals. The emergence of social media has shifted information seeking behavior in society. Consumers have moved from using their local telephone book to using online directories to find healthcare providers. Internet users consult online reviews and rankings when selecting a healthcare provider or seeking access to treatments. And many consumers say the information found on social media sites influence their decisions to seek a second opinion, choose a specific provider or facility, cope with chronic conditions, or manage diet, exercise, and stress. This spread of social media use can widely be understood as a consumer driven phenomenon. The vast majority of internet users look for healthcare information online, with many seeking online sources for self diagnosis or to diagnose someone else. People living with chronic disease are particularly likely to seek peer to peer social media sites for support, most likely attributed to the fact that they've had their disease for so long, they're willing to try outside sources and look for new types of treatment and help with it. One may say, what about professionalism and ethics? Healthcare professionals are obligated to adhere to their profession standards of conduct in all interactions and including online communication. So I would like to show you the next graph that goes into detail. From the article that I read entitled Professionalism in a Digital Age, I was also able to obtain these guidelines that were proposed from the author, Social Media Guidelines for Healthcare Providers. And it's a list of pretty much common sense guidelines, have clear objectives in regards to when you have this social media communication with patients. Also, never share patient specific information. Always abide by HIPAA guidelines, even online. Educate yourself on the policies of your employer and I adhere to them. Be yourself and declare conflicts of interest. Practice digital professionalism. Control information sharing. In other words, be thoughtful with who may be viewing your post. Um, and monitor your online identity. These online health networks, they have an array of privacy settings and which can control who can view your view. Some research that I ran across on the topic of using social media to help with treating and managing and patients being aware of disease processes and stopping bad habits was a study that involved already using one of the websites that were out to help smoking called QuitNet. And the study involved using analyzing the messages, selected messages between members, and analyzing them based on key terms and associating those key terms with behavioral things. And based on how often those things occurred, it was given a threshold, meaning the effectiveness of the key terms to cause a positive change in one's behavior. The themes identified included personal experience, social togetherness, advice, reinforcement, support. Conflict was also a theme. Adherence, the ability to stay with the program, basically in regards to not smoking again, and self efficacy and returns. The study gives the reader definition for the themes and also examples. Here at the top photograph shows you the representative terms that this complicated device, I guess you can, or no, this complicated program used to, I guess, specifically search out the words that was used and in the communication, and those words were associated with these themes. For example, in the top, we have personal experience as a theme, and the terms that was used to identify that theme was opinion and experience. Um, the words used for advice were hang, help, advice. Example of personal experience they have listed there is The results showed successful behavior change, and this behavior change in the study was based on a few psychological theories. These theories included social cognitive theory, trans-theoretical model of change theory, and the health belief model. um, the social cognitive theory basically is stating that we learn from observing others, which is very much true. The trans theoretical model of change theory proposes that people are at different stages of readiness to adopt healthful behaviors. And we know that to be true. Because just because you're ready for something doesn't mean that I'm ready for something. But um, the fact that these theories they intertwine each other. Health belief model is basically discussing the fact that how a patient perceives their condition determines how much effort they're going to put into solving it if they even recognize that they have a problem. So, in other words, a community of like-minded individuals can positively influence each other uh, to make positive changes. Positive equals positive. My proposal, in addition to already having the action plan and making sure that that is enforced, is to also create a online community dedicated specifically for lung disease and our lung disease patients. How it will work is we will require healthcare professionals to join, and when they join or throughout their day, if and when they have patients that have lung disease or disorders, they would suggest to the patient, hey, you should join this online community. I'm a part of the community as well. The physicians here, are a part of the community. You will be uh, it has resources listed on it that you can check into for discount for your prescriptions. It has members of the community that are also suffering with the same things that you are going through. It may be a positive outlet for you to discuss what's going on with your life, possibly meet friends and meet new friends and find a potential wife or husband as well. And at the same time, learning how to manage your disease and learning how to treat it and learning how to live with it. The healthcare professionals would be required, like I said, the healthcare professionals would be required to join the community in regards to the professionalism of um, of the healthcare providers. We could make sure to abide by the standard codes of conduct. And the other, I guess, question that could come about would be, well, if the patients can just contact us at any time that they feel, then we're gonna have a whole bunch of messages in our inbox. I also propose that the patients that can message you directly are only the ones that you have a relationship with in regards to having seen them before in health wise terms. The funding for the website, we can advertise on a website called Kickstart. It is a very popular website. It advertises all types of projects, and people just donate to the projects, and it gets a lot of traffic from different people, different programs, and is an easy way for us to raise money for our project of or my project for creating this website. With all that being said, I would like to conclude with, since the beginning of the millennium, there has been a remarkable change in how people access and share information. Much of this information is user generated content found on social media sites. As digital technologies and social media continue to expand, healthcare providers are going to have to change their professional communication to meet the expectations and needs of consumers. And America is a technology driven world. We're going to need to adopt with that to